right, in this last skill that we're going to do today, I'm going to be showing you guys how to properly place a traction splint on someone. This is a device that is going to be used for somebody that has a closed femur fracture. As I demonstrate how to put this on, I'll also talk about the indications and contraindications. This is not a National Registry skill, but it is still important to know how to use the device in case you come upon it out in the field. All right, welcome back. It's time for no skill demo. We're going to be demoing the traction splint. So I'll tell you a little bit about the traction splint real quick. We only use the splint in the event of a mid-shaft femur fracture. No other injuries can be associated. It has to be a closed femur fracture. So basically, if the bone has come out of the skin, can't use it. So if it's a closed femur fracture, it has to be mid-shaft, according to what you can tell, and no other injuries. That means no injuries to the hip, the knee, the lower leg, the ankle, the foot on that extremity. So it's a very isolated injury. It's a very rare occurrence that all of those factors come in because it's the largest bone in your body. So to be able to break that in mid-shaft, it's a very unique situation, but I have used it, so it does happen. The purpose for this splint is to, one, of course, splint the extremity to prevent further injury, but then also your goal for pulling traction is to relieve pain, because what starts to happen is those muscles start to contract and have spasms, so you're just trying to relieve pain as much as you are splint it. So when you first come up to the patient, of course you know what your injury is. You have your partner come in, and they can use the ankle hitch if they have it readily available to them, or they can use just their hands. And what you want them to do is hold and maintain manual traction of that extremity. And while they're just pulling gently back, you don't have to really tug hard. It's just enough traction, like I said. You're pulling just hard enough so that you can relieve the pain. You're going to get your device out, and you would want to measure this on the uninjured leg. Now, obviously, we're videotaping, so I'm going to just do it from this angle, but you would want to do this against the uninjured leg. Your goal is you want to try to set this right at the bottom of the buttocks, just where the leg and the buttocks kind of meet. That's your goal. And you want to go about 6 to 8 inches past the leg. So how you do that is you have these little knobs here. You can twist them. It makes this easy to slide. So on the uninjured leg side, I'm going to give myself enough distance so that once I connect it, I can crank a little bit of traction. Doesn't have to be a lot. Like I said, we're just looking to get relief. Remember, the kickstand goes to the bottom. Seems like that would be a given. Not always. All right, so the kickstand goes to the bottom. You have your straps, including your ischial strap. You kind of have this lined up. You want to make sure you turn these little center knobs back so that it's tight. You can open up the leg straps. The goal here is to have 2 straps above and 2 straps below the joint of injury. So you're going to have 2 above the knee, 2 below the knee. The key also is to make sure that you don't place any of these straps over the fracture site. So if you kind of can tell where the fracture happened, you want to make sure that you don't place a strap over that. So once you have it to the desired length and you're ready to go, you'd have your partner on 3, gently lift up, and you're going to slide this into place. 1, 2, 3. I can tell you your patient will probably yell just a little bit. They're not going to be too happy about that for a second once you get that into place. And with this person still holding manual traction, you're going to put your ischial strap on. That's your strap that goes up right here in the groin area. This will be your first strap you have to place. Sometimes you got to get in tight. Sorry about that. It is what it is. You want to make that nice and snug. The reason why you need to place this on first before you do traction is because obviously you start to pull traction. That's not in place. The whole splint starts to slide. Now you can connect this part. You're going to have to probably let out a little bit and pull and turn. There you go. Sometimes it is tricky. I'm not kidding. You got to pull and turn. There could be easier releases out there for some. It would make it too easy for video purposes if this one was one of those. So you got to pull and turn at the same time. That way I start sweating. That looks really good for the camera. All right. So you're going to connect. Make sure that your straps are underneath the leg, and you're simply going to crank till the patient tells you that they feel relief. Ma'am, does that feel okay? All right. Now you can check pulse motor sensory, but that's not necessarily going to be the thing that's going to change where you're going to place the splint, because you're going to have to keep the splint where it is. Remember again, you don't want to place the straps over the fracture site, and you do not want to strap over the knee, so above or below the knee, not over the joint. Once you have this in place, it's completely secured. You can go back, you can assess your pulse motor sensory, make sure your patient's comfortable and not feeling the pain, the spasms. Now you want to try to move your patient over to a spine board, and then place them on a stretcher for transport. That's it.